This program is for informational purposes only. It is not intended to treat, diagnose, or cure any illness. Please speak with your doctor when starting a new health program.
Welcome to Wellness Talk this week. Glad you guys can be with me. Hope everybody is doing well and is very healthy. Wellness Talk, as always, is the show that goes over the latest in health and healing and nutrition. And we try to make sense of health out there and give you some practical tips to help you lead healthier lives. I'm George Batista, as always, your health advocate. The platinumnutritionals.com, as always, is the website. You can also go to georgebatista.com. It'll bring you to the same thing. And we are also supported by Patreon. So if you'd like to support us at the $5 level for general support, you can do so. Or if you'd like the $15 level and become a member of our community there, this is where you will get some amazing courses for protocols for specific conditions. So if you guys want to check that out, go right ahead. You can get everything from the website. Also, just a couple of announcements that I wanted to make really quick. Those of you who follow us on Facebook, I'm really not going to be doing any more posting on Facebook. Part of the reason is because I'm just not in alignment with the way they do business anymore. And I would rather post on platforms that are more geared towards free speech. And, obviously we've seen a lot of stuff that's been going on with Facebook and YouTube and all that. And, not that I've had a huge problem with them. I have had a couple of my articles censored on Facebook, but who hasn't at this point? But I'm just not really in alignment with the way these companies handle their business, especially when it comes to COVID and especially when it comes to health in general. So I would rather focus more on these platforms, if they're even smaller platforms, that actually give where I can say whatever I want to say. So that being said, you can either follow us a few ways. You can go to our website. All the articles are there. You can sign up for the newsletter. That's also on the website. That'll give you the articles in your email. Or if you want to follow us on any kind of social media, I am on MeWe, which is the latest in social media as far as close to Facebook. And I'm also on Brighteon Social. That's another platform that's similar to Facebook. And as far as videos are concerned, I'm on BitChute and Rumble. So just look up Platinum Nutritionals in any of those platforms and you'll find our page. And you can follow us, and that's where the majority of my postings are going to be on. And again, if you're not sure where to find them, just go to my website and you'll see the links to follow there, and just click on them and follow us there. All right. So I'm going to go over just the topics that we're going to be dealing with this week. And actually, we've got two articles, and these are two brand new articles on vitamin D. And this is very important. This is why I wanted to bring it up, because again, I talk about vitamin D, and I'm constantly beating the drum of vitamin D on this program, and the science is supporting it. And it keeps coming out, and this is exactly what I'm talking about. So the first article is actually going to be from the Times of Israel, and we seem to be getting a lot of information from Israel these days. So, and the title of the article is 1 in 4 COVID patients hospitalized while vitamin D deficient die. Think about that. 1 in 4 that are vitamin D deficient die of COVID. Okay, and this is from Nathan Jaffrey. Then we have another article on vitamin D and all-cause mortality. So this is more of a general article regarding all different causes of disease. Again, all-cause mortality. This is a UK biobank study, and this is the serum 25-hydroxy vitamin D concentrations with all-cause mortality. So basically what it's telling you is it's going to show you exactly how those who have lower vitamin D levels die more of all different types of diseases, right? And then we're going to talk about N-Acetyl Cysteine. Some of you may have heard of it. It's one of those immune enhancing supplements and immune enhancing modulators. And this is one of those supplements that I absolutely recommend that I take every day. And we're going to talk about the top 7 N-Acetylcysteine supplement benefits and how to use it. And again, this is one of those things we need this day and age with everything that's going on. So pretty much everything that I go over today, for the most part, is going to be regarding enhancing immunity in one form or another. And if I have some time at the end, I'm going to show you a new exercise platform that those of you who exercise at home may want to check out. Okay, and this is, again, if we have some time. So let's get started on the articles. First, from the Times of Israel, again, 1 in 4 COVID patients hospitalized while vitamin D deficient die. So this was a study conducted in a hospital out of Galilee, and it says that 26% of vitamin D deficient patients died, while among the other patients that were not vitamin D deficient, only 3% died. Now, this is very, very significant, okay, because this represents a big clue that starting the disease with a very low vitamin D leads to an increased mortality and severity of the disease in general, okay? And this was said by Dr. Amir Bashkin. He was the endocrinologist that actually headed the team that did the research here. So what they found was, what they did was there was people that ended up in the hospital and they had their levels of vitamin D already set in the hospital, so they knew it. So this was actually out of 1,176 patients admitted to the Galilee Medical Center, 253 of whom had vitamin D levels already on record. Okay, now for the study that had been published online but yet to be peer reviewed, half of those with recorded levels were deficient. Okay, so think about it. Out of the 253 that they had actual vitamin D levels recorded, half of those were deficient. So, in short, after conducting the study, they basically kind of surmised that of those half that had low vitamin D, 26% of them died, versus the half that had normal vitamin D, only 3% died. So, I mean, this is very, very significant, okay? And basically, what he said was, and I'm going to quote him. He says, in short, after conducting this study, I would say to people that during this pandemic, you certainly want to make sure that you have adequate vitamin D, because if you contract the coronavirus, it will help you. Okay, so I mean, this is very, very clear here. And this is something, again, that a lot of doctors have been saying. There is a reason why even mainstream medicine has been talking about vitamin D for many years, because it is understood now that vitamin D enhances immunity. And if you have it at the proper levels, and I'm talking about over 50, it's just tremendous benefit that's shown. Now, it's interesting because I was watching, not long ago, I was watching a clip of a doctor he was one of those TV doctors that, I forget what channel it was, and they were bashing vitamin D because I guess there was a report that said that vitamin D didn't do anything or whatever. So they had this doctor on, and, you know, he's paid by whoever. And the news anchor asked him, well, doctor, you know, this study says that vitamin D doesn't do anything. So do we really need vitamin D? And the doctor actually said, well, the answer is no, we don't need vitamin D. There's no proof that shows that vitamin D actually does anything. So people are wasting their time buying supplements. He's actually saying this on mainstream TV. I almost broke out laughing because the thousands and thousands of studies that are out there completely are counter to what he is saying. Okay, so maybe he's being paid by whoever. I don't know how that works. But regardless, it's just the study is irrefutable. And again, doctors and more doctors are paying more attention to vitamin D, especially the 25-hydroxy vitamin D, which is the active form of vitamin D in your body. So this study out of Israel tells you that there is a correlation between low vitamin D and a COVID outcome. So again, as I always say, don't wait till you get exposed to COVID or the flu or whatever. Make sure your vitamin D is high now. Get your vitamin D tested. Whenever you get your blood work, check that vitamin D. See where it is. If it's not where you want it to be, get on the supplements, get that vitamin D up, and then anytime you get tested, make sure you ask the doctor for vitamin D test, because it's a cheap test and you want to know where that is. Okay? Huge, huge, huge. Now, next, second article we're doing is out of the UK Biobank study. And again, this is about serum 25-hydroxy vitamin D. And this was a study regarding all-cause mortality. So this is what they did. They included 37,000 patients with cardiovascular disease from the UK Biobank study, right? And what they did was they measured their vitamin D and to see if they were vitamin D deficient. And among the 37,000 patients with cardiovascular disease at baseline, 57.5% were subjected to vitamin D deficiency. Okay, so that's number one. Now, the way they selected these patients, the way they defined them, these were patients who suffered from either coronary heart disease, atrial fibrillation, heart failure, or stroke. So these were the patients that were involved in this, okay? Now, during a median follow-up, okay, of about 11.7 years, there were 6,319 total deaths occurred, including 2,161 deaths from cardiovascular disease. There was 2,230 deaths from cancer and 629 deaths from respiratory disease, and 1,305 other cause deaths. But when they did the examination regarding vitamin D, what they found was for every 10 increments that vitamin D was up, okay, so let's just call them nanomoles per liter, but we could just say points, right? Let's just call them points. So for every 10 points that the vitamin D was higher, there was a 12% reduced risk of all-cause mortality and a 9% reduced risk of cardiovascular disease mortality. So think about that. So every time they measured that, you could see the reduction in the risk for dying of all causes. Again, this shows you how important vitamin D is. Now, among patients with existing cardiovascular disease, increased levels of serum 25-hydroxy, and I'm quoting this right from the article, were independently associated with a decreased risk of all-cause and cause-specific mortality. It says that these findings suggest that elevated serum 25-hydroxy vitamin D concentrations benefits cardiovascular disease patients with vitamin D deficiency. What I found interesting in here is that it actually says it's, and this is the key words here, they were independently associated with a decreased risk. Okay, so, in a lot of these studies, they take a lot of factors in there and they say, well, it could be this, but it could have also been this, and it could have been that, or it could have been a combination of this. This study was very, very specific and actually looked at just vitamin D and adjusted for everything else and said that vitamin D was actually independently responsible for this. So again, this is brand new information on vitamin D that is very, very important. And you guys really should be, listening to this stuff because, again, this could be the difference between you having, a bad outcome, whether it's with coronavirus or whether it's with heart disease or whether it's with whatever it is, okay? Because we all know that vitamin D not only helps with blood pressure, it helps lessen your risk of cancer, lessen your risk of heart disease in general, lessen your risk of cognitive decline, boost your immune system, and again, as we've seen, lessen your risks of dying from COVID-19. top articles, okay? So something to pay attention to. Next, we're going to talk about N-Acetyl Cysteine, okay? And those of you who've never heard of it, you're going to learn exactly what it's all about, okay? It's the top 7 Knack, we're going to call it Knack, the top 7 Knack supplement benefits and how to use it. And N-Acetylcysteine is something that I take every single day. So we'll talk about exactly what it does. So N-Acetylcysteine is the supplement form of cysteine, okay, which is an amino acid that helps the body create and use protective antioxidants, okay? And by the way, one of the big things that N-Acetylcysteine does is that it helps your body create glutathione. And glutathione is known as the master antioxidant in your body. Now, N-Acetylcysteine does a lot of different things, but that's one of the main things that it does, and you'll learn a little bit more about it. But because the human body can create some N-Acetylcysteine from amino acids, particularly methionine and serine, it is considered to be a semi-essential amino acid. But that means that, there isn't necessarily a daily requirement with it. But you do have to get it. You do have to get it from your diet. But if you want higher amounts, you're going to have to supplement with it, basically. Okay. So, what is N-Acetylcysteine used for? Okay. So first of all, like I mentioned, it increases levels of glutathione, which is again the master antioxidant in your body. It helps in treating acetaminophen. A class of painkillers overdose, okay? It helps break up mucus in people with lung diseases, those with, like myself, chronic bronchitis, okay, asthma, those types of illnesses like that, okay? And by the way, again, I was a person who grew up with chronic bronchitis, or they used to call it asthmatic bronchitis when I was younger. And I did use N-Acetylcysteine every single day, and I continue to use it because it's just one of the best things to use. So anyway, it helps to break up that mucus. It helps to protect the liver, especially the liver detoxification pathways. It helps to prevent bladder and neurologic damage caused by some drugs, especially if you're on any kind of, prescription medications and things like that. And it also potentially helps to prevent colon cancer. Think about that, okay? Think about the amount of colon cancer that is out there right now and how that's such a big deal these days. So this actually helps to ward off the colon cancer. Now, so we're going to talk about each one, okay? So number 1, it has an antioxidant effect and helps to form glutathione. So again, Knack is involved in the regulation of what's called the glutamatergic system. In other words, it's a precursor to L-cysteine, which results in glutathione biosynthesis. Okay, so along with glutamine and glycine, which are 2 other amino acids that are very important, it's needed to produce what's called arguably the most powerful antioxidant in your body, which is glutathione. So that is huge. Number 2, it helps to support pregnancy outcomes in N-Acetylcysteine safe during pregnancy. Is it safe during pregnancy? Yes, it is. Why is that? Because certain studies have found that Knack used in combination with vitamin E or vitamins A and E and essential fatty acids can reduce reactive oxygen species and lead to pregnancy rate improvements in those struggling to become or stay pregnant, especially, by the way, with women who struggle with PCOS. Now, PCOS is polycystic ovarian syndrome. That is a hormonal problem in some women that causes them to have increased testosterone levels. It can also lead to type 2 diabetes and things like that. Well, Knack has actually shown to be beneficial in that type of thing. Now, it's because it increases the levels of glutathione again, which positively acts on insulin secretion and reduces insulin resistance. Okay, so one kind of feeds the other, right? So you have good levels of glutathione, which actually lowers the levels of insulin resistance if you are a person that's prone to that. Now, Knack also has anti-inflammatory effects that can improve pregnant and birth outcomes, among women with infections and those who are susceptible to preterm labors. Okay. So again, if you are someone who wants to become pregnant or is pregnant, I would definitely suggest supplementing with some extra glutathione in that case. Number 3, it helps with respiratory issues, again, by breaking up mucus. Okay. It has the ability to reduce phlegm and phlegm secretions. Number 4, it protects the liver and the kidneys. Okay. Now, when it comes to promoting detoxification, N-Acetylcysteine, what is it good for? In addition to protecting the organs from free radical damage, another use is helping to control the side effects associated with taking certain prescription medications. And we all know that prescription medications have plenty of side effects. So again, Knack can help reduce a lot of those side effects. Number 5, Knack has mood lifting and stabilizing effects. So an imbalance of glutamate is believed to be one of the contributing factors to mood and cognitive conditions because it has an impact on levels of the neurotransmitter glutamate in the brain. Knack for anxiety and depression and other mental health conditions may be useful. Okay, so again, think about somebody who's struggling with, mood issues or any kind of these illnesses, whether it's bipolar issues or anything like that. Obviously, they may be diagnosed, they may be on some medication, but Knack has been shown to help with those types of issues. Number 6, and this is a big one, by the way, Knack helps to stop cancer development. Now, I'm going to read directly from this, although it hasn't been shown to be a cancer treatment, there is evidence that Knack can defend against cancer by neutralizing free radicals that cause damage to DNA. Now, in animal studies, they were fed Knack and they experienced less cellular damage and fewer lung, colon, and bladder tumors compared to those that were fed a normal diet. And by the way, people that I have worked with who have had those conditions, whether it's cancer or just overall immune conditions, I have used Knack with them as well, as part of an entire protocol. Okay, it's not just Knack, but it's an entire protocol that should be used. Again, it's a one piece of just that entire puzzle, and I've used it with a lot of success. But again, it works with vitamin C, it works with vitamin E, it works with the other vitamins as well. So it's not just about the Knack, it's what the Knack does with everything else. Okay. And number 7, it defends against metabolic disorders. Okay. So it improves, again, insulin sensitivity, and it also helps with any other metabolic disorders that, people run into. So how much Knack do you need? Well, it depends. It depends actually what you're looking for, but the safe dosages tend to be anywhere between 600 milligrams and 1800 milligrams daily. That seems to be effective with many conditions, and I've used up to 2000 milligrams daily with people when I've worked with them. But 600 milligrams, if you take 2 or 3 capsules. Now, by the way, those of you who order from Wellness Resources, if you're looking for where to find N-Acetylcysteine, you can find it in Daily Protector, which is one of the best immune supplements they have. And Daily Protector not only has the vitamin A, it has all the antioxidants in it, but it has a good amount of N-Acetyl cysteine in it. So again, if you're dealing with any kind of liver issues or looking for liver detoxification and just overall enhanced immunity, check out Daily Protector. So that is N-Acetyl cysteine. And again, it's one of the best things you can use to boost immunity. And by the way, so in general, what I've talked about on this program so far is about enhancing immunity is vitamin D, vitamin C, zinc, and N-Acetylcysteine. Those are my top 4 when we're looking at enhancing immunity and making sure that we don't get hit with all the stuff that's out there. Or if we do get hit with what's out there, again, that you have what you need to fend it off. All right. And finally, just a little shout out. Those of you who like to exercise at home or are too lazy to go to a gym. By the way, exercise. I do all my exercising at home. I used to go to gyms, but I just don't need to anymore because I can do everything at home. If you like YouTube, there is a great channel that I recommend. My wife uses it all the time. I've used it in the past as well, and it's called the Walk at Home channel. And this is put together by Leslie Sansone. And what it is, it's a series of workouts, basically walking in place. And the workouts are fantastic. There's probably over 100 workouts on there, and they start from as little as 10 minutes a day till up to 30 minutes a day. But these workouts are aerobic workouts, but literally you're walking in place. And the workout, what it does is, they start walking in place, but then they incorporate other things into it. So whether it's knee lifts, whether it's, stepping out side to side, whether it's moving backwards and forwards, all these different types of things, but it's all a part of this. And many of these videos, you're walking a mile. Sometimes you're walking 2 miles, depending on how long the video is. But these are fantastic to use if you're home and you just want to do a quick workout. You like I said, you could do a 10-minute thing, you could do a 30-minute thing, but it gets your heart pumping, and it's a fantastic workout. If those of you who are struggling with cardiovascular problems, or you want to get your cardiovascular system up to par, this is a great workout. Like I said, I've used it. They even have one for men. It's called a Men's Mile. I've used it, but Leslie Sansone, again, does the women's miles, and she does not only with a class, but she also does it by herself. If you want to just, it's almost like having a one-on-one with her. So again, that's my exercise tip for today. Check it out. It's called the Walk at Home channel. You could just type in Walk at Home on YouTube, and her channel should come up. Fantastic exercises. Again, my wife uses it pretty much on a daily basis. She does like 30 minutes a day, and she's pretty consistent with it. And and think about it. You don't need any kind of equipment. Just put on a pair of sweats or a pair of shorts and a pair of sneakers, and you're done. You're good to go. So check it out. All right. So that's what we got on tap for this week. Hope you guys got some good information from me this week. And again, make sure you guys keep yourselves nice and healthy. Stay well. Take your supplements. Eat well. And we'll see you next week. And as always, take control of your health.